"You're so lucky," exclaimed the nurse to the soon-to-be mother. After looking at the ultrasound, she had a perfect baby. Then, after a prenatal diagnosis, the mother-to-be was given somber news. There was a 99% chance that her baby was going to have Down syndrome. This left her with a strenuous decision. Should she keep the baby, or should she abort the baby and live with the consequences? She chose the latter choice, and the baby never got a chance to live. This story was from an article, 6 Moms Share Their Real Prenatal Testing Stories, by unanimous authors, written in 2014. Her baby could have had a whole life, but she chose to abort it instead. This is just one reason of many why prenatal diagnosis is a really big debate. Prenatal diagnosis sparks a debate because of its methods, discrimination, and the effects that it can cause. My first subject will be the methods that are used for prenatal diagnosis. From an article titled Chronic Villus Sampling by John Jacobson, written in 2014, Jacobson states, "One of the main reasons prenatal diagnosis is controversial is because of the procedures involved." So basically, it's a CVS test that can be performed around 12 weeks in a pregnancy. This test just gives you basic information about your fetus. So there's 2 different types. So one is the transcervical and one's the transabdominal. I'm going to show you pictures quick. So this is the transcervical, and then this is the transabdominal. And both of them have some risks that is why it is controversial. So some of the more mild risks that I have are bleeding, infection, and then you can have a fluid leakage. And then some of the more major risks that can have is abnormalities to your baby, and then there's a 1 in 100 chance that it could lead to miscarriage. So both of the procedures are risky, but the transcervical has a higher risk. So a CVS can detect a wide range of diseases such as Down syndrome, Tay-Sachs disease, and spina bifida. Doctors provide overwhelming news for families, and they have to deal with this. They have to make a decision that they may not be able to make. They give you the option to abort a baby or to keep the baby. People usually choose to abort their baby due to the fact that they want to have the perfect child. People who consider them a burden more than anything else. This shows that discrimination is active, and it plays an active role in prenatal diagnosis. In fact, prenatal diagnosis was actually made to abolish these genetic diseases. So prenatal diagnosis testing is a commendable innovation, and it's really something that has helped us in the 21st century. However, it really has a big ethical debate to it. In the Journal of Medical Ethics, written in 1997 by Jan Albrecht, Jan was trying to solve the question, how did those who introduced prenatal diagnosis look upon the ethical problems during the introduction of the technique? To try to answer this question, Jan reviewed 64 different articles and indulged in the roots of prenatal diagnosis. Jan reviewed these articles and established 3 different perspectives on the origin of prenatal diagnosis. The first was the official view, and this just basically talks about how it's a genetic tool and it gives vital information to prospective parents. It informs them about the future and gives them the possible lines of action and the basis of these results. This perspective is based by respect for the patient and to strengthen their knowledge of it. However, in some perspective, they want you to abort the baby, so I feel like this is also not a good thing. And so it just shows that medical specialists want to get rid of the existence of genetic diseases. So the next view is the preventative aim, which we can all probably guess what that is. Basically, it just is that they want to prevent children with genetic diseases from being born. We can also still see this angle today in California. According to What Are We Losing If Down Syndrome Disappears, written in 2013 by Mark Leach, the California Prenatal Screening Program works to reduce the occurrence of birth defects and disability by offering prenatal screening and follow-up services to pregnant women in California. So not only was it intended for it, but it's still being used today to get rid of genetic diseases. And then the final view is called the economic motive, and this just says that children with genetic diseases, they are a lot more expensive, and so to try to save on health care, they want to get rid of them. And it just shows that people see like genetic diseases as a burden on society. So prenatal diagnosis can diagnose many diseases, and the fact of it is that these people can live normal lives. A great example of this would be Shane Burkhall. An article I found by Shane called Laughing at My Nightmare, written in 2013, stated, "I was prematurely diagnosed with spinal muscular atrophy, but I have never let that stop me." So in 2014, Shane wrote a book, and it talks about like all the different things that he does and how he lives with spinal bifida, but he's always so positive about everything, and it really is like uplifting. So this one story of many shows that we have phenomenal people with disabilities that live normal lives. Prenatal diagnosis discriminates against genetic diseases and sends out an atrocious message about people with disabilities. In Prenatal Diagnosis and Discrimination Against the Disabled by Lynn Gilman, written in 1999, she states, "If prenatal diagnosis is used as a tool to eradicate as many disabilities as possible in society, then it does discriminate against people with disabilities, those who are already living with disabilities, and those potential babies who have lives very successful with disabilities. Prenatal diagnosis and termination are inherently a technology of oppression and control, which serve to devalue the lives of people identified as having disabilities. Prenatal diagnosis is careless, but it also has other effects that make it even worse." So one of the effects, of course, is abortion. So according to Prenatal Testing, a Double-Edged Sword Leading to Abortion by Stephen Earle, written in 2012, 92% of children prematurely diagnosed with Down syndrome in the United States are aborted. Denmark has also declared that they will eliminate Down syndrome in the Scandinavian country by 2030 through increased screening and abortions. So this just goes to show that they are trying to get rid of it, and prenatal diagnosis is aiding it in the process. And then another thing that could happen is it could be a loss for service for those people who are already living with disabilities. Prenatal diagnosis is a complicated service that has endless things that could happen. The methods of prenatal diagnosis are dangerous, and they can lead to miscarriage and other complications, which is why it should not be in practice. It discriminates against innocent people and people that are all like the rest of us. There are phenomenal people out there that have genetic diseases, and they should be able to live a life just like us. We should take all people into our heart rather than trying to start the next genocide. People with disabilities may be a little different than us, but why should that make a difference? We are a little different on this earth, and it shouldn't matter in what way. People trying to get rid of people with disabilities need to see the bigger picture. We're all trying to make a difference in the world, but this isn't the way to do it. Don't let prenatal diagnosis get the better of us. Let's stop this problem now, and let's grow from it.